Healthcare is about people. And we in the Ontario Liberal Party had one job in 2003. We had to give 13 million Ontarians the hope that things would get better, and assurances that two-tier healthcare was not an option. You can't, he's got the fantasy platform, right? He's got the abracadabra, we can cut taxes, lower your hydro bills, we can drive down that deficit, and we can continue to spend more. It just doesn't make sense. So the only option that I see is that he would introduce some kind of two-tier health care, and some of his candidates, Kevin Godett, the Canadian Taxpayers Federation, is on the record as believing we should be able to buy our way to the front of the line. I don't support that. Well, it would be a huge step backwards. It would push us back decades. The best decisions are made as close to the ground as possible. It is impossible to make the kind of transformation we need in our healthcare system. It's impossible to do that from around boardroom table at Queen's Park. So to eliminate the voice of the community, of individuals who live in those communities who are affected directly by decisions, is a very big step backwards. I think it's anti-democratic, and I think it's foolish. Until our local health networks, no one had the responsibility of actually making the system work across the silos from the perspective of the patient. It happened in some places, in some small ways, but for the most part it just didn't happen. The LHINs are actually driving that collaboration, resulting in better patient care and better value for healthcare money. So we took a stand that we knew that the price we were paying for generic drugs was simply far too high. So we took a stand to reduce the price of generic drugs. At the same time, we said, we're not getting the best value out of our pharmacists. They have so much more skill than we're paying them to put to good work. So we are paying pharmacists more to do some of the things that matter to people. And I think as we look forward in our healthcare system, I hope pharmacists will play an increasingly important role in our healthcare system. They can do so much more than just dispense drugs. And prior to the reforms, that's pretty well all we paid them for, was dispensing drugs. So we see pharmacists as being a much more integrated part of our healthcare system.
Some are saying they have to work a lot harder now for less revenue after drug reform. Do you see maybe reinvesting more if you're re-elected in those advanced services?
We are committed to increasing the services that we pay pharmacists to deliver, and we're working on that right now. When I talk to pharmacists, particularly the new pharmacists, they're very excited about the new way that pharmacy, the new role that pharmacy will play in healthcare. Just yesterday I was in North Bay. I had a tour of the North Bay Nurse Practitioner-led clinic that is going to open in August, and I tell you, people are very, very excited about this new model of care. We're committed to opening 25 new NP-led clinics. I think 7 of them are up and running now. Patients love the care they get at the NP-led clinics. The future is very, very bright for nurse practitioners. We're expanding the scope of practice. We recently announced that they will have admit-discharge privileges at hospitals. So we see a very bright future for nurse practitioners.